Hello, and welcome to Strong Against the Odds podcast. I'm your host, Sarah. Today I'm going to take a look at what is Turner syndrome. Turner syndrome is a chromosomal disorder affecting 1 in 2,500 female births. And if not diagnosed at birth, it will be diagnosed through a karyotype test. But a karyotype test will also be needed if diagnosed at birth to see what type of Turner this child has. So, with that said, there are two types: mosaic and classic. So, let's start off with classic TS, also known Turner syndrome. We shorten it to TS. So, with classic, you have a missing X chromosome. So, your chromosome analysis would be, or karyotype would be 45X. And with classic, you will also be more prone to some of the things I will mention as this video goes on. Now, secondly is mosaic TS, which means that some of the cells have 46XX, some will have either 45X or 46X with a messed up second X chromosome. So, with mosaic, a lot of the medical issues are not as common. Yes, we are still at risk, but it's not as bad. So, some of the features now that you can see and be like, this person might have Turner's. So, let's go through them. Number one, a webbed neck, where their neck comes like that, a webbed neck. They'll also have swollen or puffy hands and feet. As you could kind of see, I have some puffiness to my fingers. Short stature. The average height of a person with Turner syndrome without growth hormones is 4 foot 8 inches. I'm lucky. I'm 4'11", no growth hormones, but my story will be coming later on in this series. Low set ears. A broad chest. Low hairline. So that's some of the physical features that you can see to determine if somebody can possibly have Turner's. Alright, so here we go. Next topic. What are some common issues that can arise or be born with having CS? So we could be born with a horseshoe-shaped kidney, which means it's one. Both our kidneys decided not to separate. It fused together, make a horseshoe shape. So kidney problems. You could be also born with a bicuspid aortic valve, or just some issues with the left side of our heart function. The big one being infertility, because we can be born with streaked ovaries, no ovaries, possibly no uterus, maybe a uterus, just infertile. Hearing loss is another one, common one. Eye problems. A lot of us, I think, we wear glasses and things like that. Also, autoimmune diseases such as like celiac is the most common one, like Crohn's, Hashimoto's, thyroid. It's another issue that we can develop. Let's see. Yeah, so with that being said, there's one medication that we will need to be on for, I guess you could say, until menopause age, and that is our estrogen progesterone medication, because without that, our bones will start to not be strong anymore. And, you know, stuff like that. So, with having said that, let me continue on to what kind of specialty doctors you will need or may need if you have Turner syndrome. So, the first two that you'll definitely need to be connected with is an endocrinologist and a geneticist. What a geneticist will do is they will tell you exactly what karyotype you have. Like, do you have mosaic? Do you have classic? And kind of tell you how the disorder came about through the fertilization process in creating a baby. Okay, and then an endocrinologist is one of the most important ones you need to have in your arsenal for doctors, because they will tell you what other doctors you need to see and how often you need to get certain tests done, like a bone density test, thyroid function test, things of that sort. And then next you have a cardiologist, which will check the function and the overall structure of your heart. And depending on how your heart looks, you can go see the cardiologist from anywhere to 3 to 5 years. It may be less depending on how your doctor feels about your current heart state. Next is an eye doctor, because we can have trouble with eyes. Like I said, and another one would be the ENT, because we can have problems with ear hearing and stuff like that. I myself have hearing problems. So, and the earlier you get diagnosed, the easier it's gonna be for your child. With the help of a developmental therapist and a psychiatrist that are there to help develop skills that, let's say, become easy to those not affected with Turner's. Some of these things can be social cues. We can have nonverbal learning disorder, which makes things really difficult. Anxiety, things of that sort. So overall, our mental states can differ from those that don't have our diagnosis of Turner syndrome. And then the last thing is a gynecologist, which, of course, every female needs to see one. We all know that, girls, right? Make sure everything's kosher, you know? Even though we are infertile, yes, but we still need to go see a gynecologist to help get on hormones, to make sure everything with our female anatomy is healthy. Because just like normal females that don't have the chromosome anomaly we do with Turner's, we can still develop these things. We still need to keep an eye on those things, you know? So, yeah, I've seen all these kind of doctors except for a developmental therapist because I didn't find out till I was older. Um, Another doctor I see that some may need to see is a gastroenterologist because I do have an autoimmune disease that affects my gut. So if you have that, then yes, you would need to see a gastroenterologist as well. So that's another one that could not be needed in your care. So to kind of wrap things up, basically Turner syndrome is a chromosomal disorder affecting only females. It's rare, 1 in 2,500. Um, you went through all the features: the broad shoulders, the webbed neck, low ears. We're going through some of the issues, the heart issues, the horseshoe kidney, hearing loss, and some of the specialists needed, like endocrinologists, cardiologists, geneticists, all of that. So I am going to sign off on this episode, and the next episode will be a little more in depth of things to look for at certain ages when finding out if your daughter has Turner syndrome. So thanks for tuning in. You can catch me on YouTube, Spotify, and pretty much anywhere where you can find your podcast. I will say the list of those names in the next episode, or just post them with this one. So, peace out till next time.